channel. In today's video, I'll be showing you circumcision procedure. If these are the kind of videos that you like, kindly consider to like, share and subscribe. Without wasting much time, let us jump right into welcome back. Now, on my back table, and I have my sponge holders, I have my Addisons, both tooth and non-tooth. I have scissor, this is a curved scissor. Here I have mosquito, both straight and curved. I have here a straight scissor and a needle holder. Here I have my checklist to show the content on my set, the content on my set. This one is used to look if whatever I have on my table is what is written on this checklist. Again, here I have my indicator to show sterility of my instruments. Here I have my suture. This one is rapid. Okay, it's a rapid, it's the skin suture. Here I have my bipolar. I use this for ligation, mostly for hemostasis, to achieve hemostasis. Here I have my towel clip. This one I use it to hold into place my bipolar cable. Here I have my roses. Here I have my, these are fluids for cleaning. On this belly pot, I have my saline. This one I use after the procedure. I use it to clean my patient. This one is Hibitane. Usually use Hibitane on the private parts because it does not cause irritation. Now, here I have my kidney dish. On my kidney dish, I'll put my sharps. After suturing, I'll put my sharps here. Or, as I told you in my previous video, I'll use this one to pass my blade in case I use my blade, okay? Here I have some extra instruments. I have the holder and two other mosquitoes, okay? Now, cut. As I showed you, I'll be using my Raytech gauze. The way I showed you in my previous video on how to load your sponge stick. I'm doing this slowly for my students to learn. This is one. I'll place it here. I'll do the same to all of my Raytech. I'm doing slowly so that you can be with me step by step. For you to know this is a Raytech, you will see this blue line. You know this is Raytech. Raytech means it is X-ray detectable. Okay? These three are enough. Now, when I'm passing this to my surgeon, I'll just dip it. I've said you will start with Hibitane. I'll dip it, then I give it to my surgeon, like this. This is how I will pass to my surgeon, okay? Let me leave this one here. Let me remove this one to avoid soiling my sterile film with the Hibitane. Then I'll take my needle holder, this one, and I will load it here. All my waste I'll put on one corner. Then, as I had shown you in the previous video, at an 90-degree angle, you ensure it is pointing on your chest. I'll put it here where I'm seeing it to avoid pricking any other person. Then after that, I will ask my assistant to put here Circumcision. We usually use Circumcision after procedure, after circumcision. We don't dress our patient here. That's our protocol. We don't dress circumcision patient unless this patient has a history or has a tendency of bleeding a lot. That is why we dress this patient. And the dressing material that we use, we call it combat. Okay? But if my patient is not bleeding, I'll only put my my Circumcision here. Then I'll apply on the surface. Okay? Now, I want to show you how Circumcision looks like. I request my assistant to show to pour here. Now, my assistant has applied here some Circumcision. This is how Circumcision looks like. I hope you can see. No. This is Circumcision. Now, how we do this procedure, how we do circumcision. After we've washed the surface, my surgeon will use this curved scissor to cut the foreskin. Then, after cutting the foreskin, we will use our rapid suture to suture that area. Now, in case of bleeding, we have our bipolar. You can use bipolar or monopolar to achieve hemostasis. Okay, you ligate. You connect it to the Bobby machine or to the diathermy machine. Then you use it to ligate that area. Now, if you have maybe a large vessel that is bleeding, we use our hemostats or our mosquito artery forceps to achieve hemostasis. We will clamp those vessels using the mosquitoes. This one I'm holding here is a curved mosquito artery forceps. Here I have a straight mosquito artery forceps. Now, after all that, my straight scissor here, I use it to cut the stitch. We call it a stitch cutting scissor. Okay? And when you're cutting, you don't cut like this. You at least bend your scissor like this, then you cut. You bend you don't go straight like this at a 90 degree. At least you tilt your scissors, then you cut. Now, after we've done all that, we have achieved hemostasis. We have applied Circumcision on our patient's skin. We will take our normal saline. We will wet a gauze on the normal saline. Then we will wipe the surface where maybe you have blood soil. Okay. Now, without much further ado, let us see each other on the next video. Kindly don't forget to comment on the comment section which kind of video you want me to do for you next. So